Hey there, Dr. Ross here with Inver Chiropractic, and today I want to talk to you a little bit about tension headaches. Tension headaches and just headaches in general, whether that's tension, migraine, cluster headaches, these are the third most common thing that we see patients for in our clinic, behind neck pain and low back pain. And the most common one of the neck pains that we see, or the headaches, is tension headaches. And tension headaches are very common, to where 80 to 90% of Americans suffer from tension headaches at some point in their lifetime. So being able to address it and figure out the exact cause of it is super important, because the actual headache piece is just a symptom of the root cause that's causing it. So we're going to start with a little bit of structure. Structure is super important when we're talking about our spine, especially in our neck. And we see it a lot to where we start to lose the structure in our neck. And I'll show you what that is. So when we're looking at the neck and the spine actually from the side, there are 4 different curves that we want to have. One's down here in the sacrum, another one is here in the low back, and then in the mid back, and then up here in the cervical spine here. So this is our lordotic curve, and we need that C-shaped curve for a lot of different reasons. But what happens is all the muscles are attached back here, so when we start to lose this curve, which is very, very common nowadays, it starts to go forward and it starts to straighten out, and then sometimes it completely reverses. So all these muscles back there are pulled tight like a rubber band. And I will show you an example of that. So if you take a rubber band, and you can do this at home, and now you have this C-shaped curve here, just like we want to see in our neck, and then you start to pull that curve out of there, these bands get very, very tight, and there's tension, aka a tension headache. So if we can put that curve back in, get these muscles to settle down, actually want to strengthen them a little bit too, that is going to help in turn get rid of the tension headaches. So the starters for people, we need to figure out what is going on, and that is where we really succeed here in the clinic. We have a lot of different modalities. We have a lot of different professionals. We have a doctor of physical therapy. We have multiple doctors of chiropractic, to where we can really fine tune and get to the bottom of what is going on. And if it's a tension headache, you're in luck, because there's a ton of different things that we can do. So remember, tension headaches, a lot of the time there's structure that's involved, there's muscles that involved, and then when they aren't happy, it irritates the nerves, and then that's where we can get that referral pain. So if you guys have any questions, please ask below. Remember, 80 to 90% of people deal with this, so if you know anyone who has dealt with tension headaches, please share this. We would love to help them. And again, share, comment. We love you guys, and we'll see you later. Thanks.